Well, if you didn't get your flu shot yet, this season is shaping up to be a particularly bad one. And it comes as we mark the 100th anniversary of one of the world's most catastrophic disease outbreaks, the 1918 influenza pandemic. Fox 5's Lauren DeMarco live tonight with what you need to know. Lauren.
Sarah, this is one of the worst flu seasons that we've seen in recent years. Here at the D.C. Department of Health, they say that they have seen a sharp increase in cases in just the past week alone, and that's what we're seeing across the country. Now, the flu vaccine this season, it's only so effective, and experts believe that it's only a matter of time before we see another super flu. So there's now focus on creating a super flu shot.
I was sick for a week, 10 days.
Shaking and sweating, fever.
This year we've had colder weather earlier, and doctors say the flu virus survives better in lower temperatures. Not to mention the holiday season, lots of close contact and travel. Most hospitalized patients have been 65 or older, and according to the CDC, as many as 20 children have died of complications from the flu. This young boy from Michigan may soon be added to that list.
When I came into his room, he was kind of on the floor. The only way I can describe the way he looked is he looked like a fish out of water.
12-year-old Michael Messenger died last week, 2 days after exhibiting flu-like symptoms. It's unclear if the virus killed him. The autopsy results are pending. Doctors estimate this season's vaccine is only about 30 to 40% effective against what's being called the dreaded H3N2 strain. Fox 5's Dr. Shilpi explains.
It's being called the dreaded strain, particularly because the vaccine doesn't work as well, so people have more severe symptoms to that.
The virus often beats our best defenses because it constantly mutates. This year, we mark a century since the 1918 super flu outbreak that killed tens of millions of people around the world. There's no way to predict what strain could trigger another pandemic. Dr. Anthony Fauci with the National Institutes of Health says we have to do better, and by better we mean a universal flu vaccine, a vaccine that is going to protect you against essentially all or most strains of the flu. NIH has designated creating a universal flu vaccine a top priority.
Because of the way that the vaccine is developed, which is through the egg method, some say that this is kind of an antiquated method, and so using more updated technology could help us to get a more specific vaccine. If we were to have a larger, more universal vaccine, it would cover several different viruses, and hopefully, because it's more specific, it could help us protect you for several years at a time.
Right now, the CDC recommends washing your hands frequently and disinfecting your home and office to keep the virus from spreading.
And doctors say they can't recommend it enough. Go get your flu shot, even though they're saying that it may not be as effective this year. Even if you do get sick, it lessens the amount of time that you're sick and the severity of your symptoms. And also, the youngest people in our society and the oldest are the most vulnerable. So when you protect yourself, you're also protecting from passing on the flu symptoms to them. The other thing is, if you do get sick, stay home. The only reason you want to leave is to go see the doctor, and if you do that, there are some medications that you can take that can lessen the symptoms, but you have to take them within the first day or two. Live in Northeast, Lauren DeMarco, Fox 5 Local News.